to the Select Board's meeting for Monday, January 11th, 2021. This evening we'll begin our agenda with, as we normally do, with the coronavirus community update from Fire Chief Mike Cassidy. Hi, Mike.
Good evening. Thank you for having me. I would like to point out that we are joined this evening by my Assistant Director of Emergency Management, Paul Coffey. He has joined the Zoom call with us this evening. Paul has been a member of the Holliston Fire Department since August of 1992, and he has been my Assistant Director of Emergency Management since the early 2000s. He's a valued member of our department, has decades of experience with the state, and he's joining us today just to make sure that you have a face with a name. In terms of our status, next slide, please. And I did check my math tonight to make sure that our numbers reconcile. We have 47 additional cases since last Monday night. There have been no additional recoveries reported to us by the Board of Health through their nursing consultant. We have had no additional COVID-related fatalities that we're aware of, but we are at 125 active cases right now. Those are spread out over 83 unique addresses. We've got clusters at single-family homes. We have clusters at multifamily dwellings, elderly housing complexes, and of concern to me is that we once again have multiple cases at the long-term care facility in town. We also have multiple single cases at both elderly housing complex, multifamily dwellings, and a lot of single-family homes. So looking at the graph, we just continue to see an increase in case counts, and this is not unique to us. This is consistent with what we've seen in the region as well as in the rest of the Commonwealth. Looking at our positivity rate, we continue to climb. Last week we were at our all-time high of 6.2, and as I said in my analysis after the state published their update on Thursday evening, this is again partially due to number of new cases during the 14-day period, as well as the lower number of total tests taken by Holliston residents during that 2-week period. And this is not unique to us. When I was on a call with the White House task force last Wednesday, one of the presenters did indicate that during the week between Christmas and New Year's, there was a 40% reduction in testing nationwide on average. So there were, with a lot fewer tests being taken, but more cases being reported, that obviously is going to drive our, as well as the regions and the state's positivity numbers up. Looking around at our neighboring towns, quite a few of them are like us in the red, a couple of them are in the yellow, but everybody's got high counts these days. Our social media messaging continues. We are reminding people.
Mike, can you go real quick? I don't mean to interrupt you.
No, by all means.
But relevant to that statewide slide, the previous one?
Yes. Chris, can you go back?
Wasn't Massachusetts recently introduced to a new phase where we deemed to be severely on notice, according to the federal government recently?
Yes, and that's largely due to our total overall average positivity rate.
What does that mean in terms of overall readiness or preparedness? Anything?
No, it's just an issue of, for the longest time, you may recall that with our travel order, we weren't allowing people from virtually everywhere but Hawaii in at one point.
Yeah.
We're now on everyone else's least favored nation status. So because of our high rate, other states don't want to see travelers from Massachusetts coming to their location.
Thank you. Keep going.
Absolutely. So we continue to harp on the messages with social media, reminding people of all of the mitigation strategies that they need to continue. The governor last week, next slide, did extend the temporary gathering size restrictions that were due to expire on January 10th at noon for another 2 weeks. So those now go until January 24th at noon. I did share with you last week that there had been an update to the vaccination priority lists. So next slide. This graphic now does reflect the individuals with 2 or comorbidities and or age 75 high risk for COVID complications, first bullet within the phase 2. Next slide. I know there's been a lot of questions about first responder vaccines. First responder vaccines were available starting today. The blue dots on the map are those regional coalitions that we talked about, where local boards of health worked with other local boards of health. So those are usually closed to individuals from those communities that were collaborating. There were over 60 of those across the state. There are a couple green dots on the map right now. Closest to us are Marlborough, Worcester, and Needham. Those are open to first responders from anywhere in the Commonwealth. So some of our responders have made appointments at these locations. The mass vaccination sites that we talked about that the state DPH will be overseeing, those won't be opening until next week. So later on this week, we expect green circles with white stars to be appearing on this map, and they will be able to register for their vaccination at the location. Closest one to us is expected to be in Walpole. Again, it's not populated on the map yet, so we can't say with certainty, but the expectation is that starting next week, our first responders will be able to go to the mass vaccination site overseen by DPH that will be held at Gillette. And again, the key for why we want to make sure that they get to one as close as possible is because they're required to go back to the same site for shot number 2. So although right now they could schedule a shot in Amherst, that would require them to return to Amherst for shot number 2. So with that, I will pause for the first half of my update.
Start with you, Mrs. Strauss. Do you have any questions?
Just a couple. The first is, I mean, I know the information is still sparse, but has there been any updates about the strain that they've located in the United Kingdom? I've heard it's been spotted in the United States. I've heard
Closest to us has been Connecticut and New York.
Yeah, because I've heard that the testing of it, and they haven't really done a lot of genetic testing to really isolate it in this country as effectively as one would like.
Correct. So from a surveillance standpoint, it is present in the country, and they are aware of that. And to the best of their knowledge, the vaccines that are currently being administered should still be effective on this strain as well.
Okay. My second question is a little more general. Just thinking about your experience as a first responder and with our ambulance services. With respect to hospitals and things like that, could you just speak a little bit about what kind of an impact you're seeing based on COVID for either COVID cases or non-COVID cases? I mean, has there been any? It seems like, I mean, I hear a lot of chatter about changes, but I'm a little isolated from it, so I wanted to hear from you.
Sure.
What your experience is with those.
Hospital workers are tired. Pre-hospital workers are tired. There is a backlog when we take a patient to the emergency room, regardless of whether it's a patient exhibiting COVID symptoms or whether it's just one of our traditional medical patients. Our turnaround time is longer because there isn't always a gurney for us to transfer our patient to. And we certainly, in the last couple of weeks, have seen an uptick in patients with either presumptive COVID symptoms or positive diagnoses that we've been taking. We've transported more in the last couple of weeks than we did in the first surge of the spring. And everyone really has coronavirus fatigue at this point. I mean, we were discussing this prior to the meeting, but it's certainly our responders on almost a daily basis are being sent to either a location where someone has a diagnosis or where they have possible symptoms. And sometimes it's a case where someone has symptoms, their primary care physician suggests that they go to the hospital. We go out to the house in the ambulance, we evaluate them, and they decline to go to the hospital. And they just say, I don't want to go to the hospital, I'd rather ride it out here, and we again let them know what their options are should their symptoms get worse. But as I first briefed the board last March, the expectation was that there would be a large percentage of people who would come down with the virus that would be able to manage it at home, and only a smaller percentage would require hospitalization, and even a smaller percentage would require ventilators. But long answer to your question, the hospitals are full. The hospitals don't have a lot of flex. They don't have much surge capacity left, and their staff are all working long hours and going through a lot of PPE, as are we.
Sure.
But we still have a good supply.
Okay. All right. That's all I have. Thank you, Mr.
You. Tina.
So Will you pivot on the public education, or will you add to the public education the benefits and the need for vaccination? So if you go back, you don't have to up on the screen necessarily, but when you go back to that slide that has the different phases for when
Yes.
individuals will be vaccinated, we're looking at a February start for some in the general public, and then an April start for the majority of the others,
Yes.
That's a quick, that's a short timeline. Will you add to or pivot your public messaging to put out there the need? The one concern, Ben tapped on it. Ben, you were not alone. I got my second dose today. I texted my sisters, and my sister in France turned right around and said, well, hey, Tina, I hope it protects against the new strain.
Sure.
To which I felt an overwhelming sense of frustration when I got that response, because I thought the science is that this will protect us.
Right.
So as we hear about new strains coming, I think the general public and most of us will think, oh, I wonder if. So how are we going to get the message out, the public education, that the vaccine is a critical piece to Holliston's ability to respond to and recover from the pandemic?
Excellent question. So both CDC and Mass DPH have messaging around the importance of vaccination.
Okay.
We have already put up the graphic twice in the last couple of weeks with regards to when can I get the vaccine. The first graphic when they first came out with their priorities and their phases, and then when they updated it last week, I did again put up the new graphic to reflect the new scheme, because the state is reevaluating CDC guidance on a weekly basis, and they are updating their vaccination documents on the website by 5 o'clock on Tuesdays and Thursdays. So we will continue to push out messaging, and so as it gets closer to the point where these individuals in those categories, beyond first responders and beyond the COVID-facing healthcare workers, are able to get the vaccines. Right now, there isn't a place that those individuals are going to be able to get it readily, but the DPH planning with these mass vaccination sites that will be stood up as soon as next week, where hopefully most of our first responders will be able to avail themselves of the vaccine, the expectation is those sites will remain open through phase 3.
Okay.
And so part of our messaging will not only be, you should get the shot, this is where you can get the shot, this is the benefit of getting the shot, this is part of our overall strategy of keeping our community safe and reducing the risk of disease transmission. So yes, I was conversing back and forth with the health director Friday morning after the DPH conference call about the timing of that messaging.
Okay.
We don't want to do it too early, because if we tell people, hey, don't forget to get the shot, but they're not in an eligible group yet, there's going to be a lot of frustration.
Right.
And we don't want people jumping the line and trying to squeeze out people who are supposed to be getting it in the current tranche of individuals.
Okay. I only have one other question. You mentioned that you're showing up at homes and people are saying no thank you for the trip to the hospital.
Right.
Are you seeing return calls where you go back and the patient is more critical?
Scrolling back through, we've had a couple, not that entire scenario where they declined first and we went back. We've had ones who we've transported, and then a couple days later we transport again. So they were seen, they were evaluated in the ED, they were discharged home, and then a few days later their symptoms had not gotten better or had gotten worse, and so we took them again. But I have not had they had refused, and then a few days later they asked for us to come back.
Is that going to change, from what you've heard to your calls, is that going to change what happens when they get to the emergency room, that treatments might change, that they're not then coming back a second time? Are you aware of anything that's changing in that emergency triaging in the ED piece to these patients when they show up?
So the challenge is the capacity of the emergency departments to absorb those patients into their hospital network. And if they don't have beds upstairs and they're prioritizing worse patients for admission, they're doing what they can in getting people out of the ED as quickly as possible. So it's an ongoing issue with our healthcare system.
Thank you.
We're going to have to continue to monitor it.
Thanks, Mike. Positivity rate is at 6.2, correct?
Yes.
And that compares to surrounding communities, you said?
Yes.
Ms. Hine brought up a great point, I thought, which is relevant to the vaccine messaging. Broadly speaking, Mike, what's the vaccine schedule again? Just remind folks at home in terms of the broad timelines of when the vaccine will be rolled out.
So phase 1 is December through February. Phase 2 is February to April, and then Phase 3 is scheduled currently for April to June. And Phase 3, April to June, is when the general public will be eligible.
The community spread, I think you've been putting this in your weekly message to us, is well underway. We're seeing the spread in Holliston through primarily social contacts. Is that, would you say broadly or more specifically, the major cause of the spread we've been seeing?
The ones that we can trace. You know, there's still a large percentage of individuals who, during contact tracing, when you walk back through them, where have you been in the previous 5 days, they can't identify an area where they may have come down with it.
Our nursing homes, however, are not much in that group any longer.
Yeah.
They've been firmed up a bit.
Right.
And through...
And there is a cluster at our long-term care facility.
Current. Okay. You know, every week, you know, we focus a lot on the report you give us, and the numbers that come with it. And I think we all kind of recognize the moment in time that we're in, and without this feeling of helplessness, there's a lot that we can do as citizens. You go through that every week. You remind people every week. Mr. Sparrow has used the words fatigue, message fatigue effectively, because I think there is that. I think people know what to do by now. I had drafted a message that I was going to ask my colleagues to share with me on co-signing and submitting to the Holliston Reporter and other groups to underline the need for us to adhere to the rules that the CDC is laying out, but then it occurred to me that a lot of the messaging is simply the same message. It's exceedingly frustrating to be here every week watching the numbers go up, the colors go red. I think it's safe to say from my own perspective as a citizen, it is difficult to watch and to listen and to hear the numbers going in the direction they are when it all boils down to, in many cases, personal choices. And the personal choices that people are making right now are their guard is down, they feel relief, and then the COVID virus creeps in. And it's an insidious pandemic. I think Governor Baker has used those words repeatedly. So, I mean, I don't think my colleagues would disagree with me at this point, but the message has to be that the sacrifices that Holliston citizens need to make have to be confronted every single day. Every single decision you make is having life or death consequences at this point. We have a winter ahead of us. The virus is not going away, but the vaccine rollout will take months before it really has a hold in a way to help control the spread. Between now and then, there's just so much at stake. So at the risk of sounding overly preachy tonight, I would think that my colleagues would join me in just saying again to the citizens of Holliston, please make those difficult choices to isolate yourselves as much as possible, practice these social distance rules, and don't give in. Don't give an inch to the virus, and don't let your guard down. These are messages that sound so familiar to us after almost a year of this, but the risk is just so high.
And one of our biggest challenges in prevention education is how to make that message resonate with individuals without being negative, and how to really continue to be positive and affirming and not judgmental. I'll give the parallel to what we do in the fire service as we try to educate people. And for years, there was a danger of fires being caused by smoking. And so the challenge that the fire service faced was, how do you communicate to the public that their smoking, which was a personal habit, a personal choice, to use an analogy as you've been describing with some of these COVID issues, is impacting other people because they're burning down their house, they're causing damage to their neighbor's apartment from smoke damage and stuff like that. And so the positive messaging that we got to was, if you're going to smoke outside. And so in the same way, the challenge for us in this public health messaging is, how do you make sure that all of our messages are positive? So, avoid crowds is kind of almost a negative, because it's avoided tends to be an oppressive
Sure.
and restrictive verb. So that's why you want to be careful with the messaging and say, try to limit group sizes. So there's a slight nuance to the way we do our messaging, but I agree with you. The message is the same. We've been saying this consistently since March 11th, when I first briefed the board, and we can't let up. And again, to look at the positive, and we saw this when we looked at data a couple of years ago related to teenage drinking percentages. You know, instead of saying that, 25% of juniors and seniors were binge drinking within the last month when they took the exam, we would say 75% of the students aren't binge drinking. So in the same way, we have 126 active cases. We've got almost 15,000 people in Holliston who currently don't have the disease, and we want that number to rise.
Right.
So it's just, there's always this dichotomy of how do you give the message and the information in a way that affirms people, doesn't cause them to feel like we're judging them for the personal decisions they're making, but at the same time, we do need to be firm with them that their actions have consequences for other people.
I was just going to jump in and say, today on one of the radio shows that I listened to, they had Tom Mountain, who is the vice chair of the Massachusetts Republican State Committee. He tested positive in mid-December. He attributes it to a White House event, but regardless of that, he was on air today saying his message to all those who perhaps are struggling with the steps that need to be taken at this point in time and the fatigue that's coming along. He said this. He said, it's the fourth quarter of the Super Bowl. There's a minute left. Don't be the guy that gets carried out now.
No.
Keep up your guard.
Right.
Finish strong. Don't be that guy.
So true.
I just thought that was a great way to motivate when everybody's ready to perhaps turn the other way.
Right.
Mike, I'm not sure if you're going to bring in the upgrades at this phase of your presentation to the public buildings that we've done, or if you're going to do it in the next.
We can do it as part of the CARES Act sort of update.
Next phase. All right. So we'll go to the Zoom real quickly to find out if anyone has any questions regarding the coronavirus community update for Chief Cassidy. We're going to be moving on in a moment to the programmatic piece, so hold your questions if it's there. Anything right now? I have a question, it looks like, from Linda Marshall. Linda, go ahead. If you need to unmute yourself, your hand is up.
Yes, there I
Go
go.
ahead.
I just have a quick question, Chief. Do we have any idea besides the mass vaccination sites, if any individual sites will be, such as the CVS's, the Walgreens doing the vaccine? Our seniors are getting the message because I'm getting calls asking for more details and what they should do as far as getting the vaccination.
Great question. Thank you, Linda.
Sure, great. I agree. Excellent question. So DPH is still working with the partners. Currently, the major pharmacy chains such as CVS and Walgreens are focused on the congregate care settings. Is it possible that in phase 3 they might be able to turn and start offering in their stores? They still haven't worked out those details, but as soon as we have those, we will absolutely be communicating, and we know that you're a great cheerleader and great messenger to your target audience, so you absolutely will be part of that communication plan.
Thank you.
Of course.
Any other community update questions for Chief Cassidy? Hearing none. Chief, we'll move on to the second item on the agenda, the CARES Act Programmatic update.
Excellent, great. So as we've talked about before, the CARES Act funding was extended through the end of the calendar year 2021. In terms of updates of some of the things that we have been able to accomplish, this past weekend we did deploy air purifiers to several municipal offices here at the town hall. Thanks to the facilities manager for his assistance in making sure that those were deployed properly. And again, to show the partnership that exists between the municipal side and the school district, we got the exact same make and model that the schools were able to deploy over 200 units into their classrooms, just so that there's standardization and that should somebody run into a pinch and somebody needs a filter and somebody ran out of one, I expect that there will continue to be a great exchange back and forth between those two entities. So in looking at our requests, I have 3 3 requests for you this evening, and I do see that we are joined by several members of the school, both administration as well as committee. So the first one is from the Holliston Public Schools. At their meeting on Thursday evening of last week, they did vote officially to request CARES Act funding for a PCR testing machine and supplies. The request was for $4,500, which would cover the PCR testing machine, but you'll note there's an asterisk there. The challenge is Abbott has put a pause on new customers and fulfillment of requests for additional equipment being deployed. So although the public schools have made the request, the school committee specifically has made the request for some of the remaining CARES Act funds that we have to be earmarked for such a machine. The salesperson has said they're not currently accepting orders, but they will definitely reach out to me when they are. So I'm not sure how you want to handle this request, whether you want to approve it so that we keep that money in abeyance. So if one becomes available, we have the ability to quickly pick it up.
Scarlett, questions on that item?
Do they have any ideas of how long?
None.
Okay. No, I think it's a better idea to put the money aside, especially given the amount, to make sure that it's available, so as soon as we can jump, we can jump.
Likewise, I think our schools have been so proactive, our administration has been so proactive that I am sure we are at the top of any list, the public schools, that is, to purchase the equipment, so the money should be at the ready for them.
And this would be part of a multi-tiered approach to testing. They are pursuing every different opportunity that they have now between the Buy Next Now program that they were accepted into in the early phase because we are prioritized according to DESE because of our curriculum delivery model right now. And then there's also the application that was being made for the pool testing that will be done later on,
Okay.
available this spring.
I was going to ask if that was, the PCR was related to that. Okay.
It would happen in a parallel track.
Got it. Okay.
I've got a couple of questions about sort of the program side of this item. If
Sure.
you can answer, that's great. If we have to go to Dr. Kuska, that's fine too.
Absolutely.
So this machine, is it replacing the outsourced testing model that had been in place, or has something changed programmatically at the schools where they want to have an on-site device? And if so, we have multiple schools, there's one device. Tell me how the program would work.
Sure. So this would not replace the Buy Next Now program that they have available through DESE. They have 500 test kits that have not been used yet from the Buy Next Now program through the DESE program. This would be for employees who had been in close contact after, of course, waiting the 5 days, or these would be for a symptomatic employee and could possibly, what's happened in other communities, and I know the model that the schools are holding up is what's taking place with our neighbors in Ashland. They've also made some of their testing available to public safety or other municipal employees who became symptomatic, because right now, the way the Buy Next Now test is designed for is for a student or a staff member who develops symptoms during the day when they're at school, because the expectation is if you're not feeling well, you're not coming to school. And so if you arrive at school and you're feeling well, but then you develop symptoms during the day, the Buy Next Now would be used to do immediate testing. So this would be a supplement to that. And then the other way that Ashland is also using this Abbott ID Now testing is for employees who may have had to travel for perhaps a family emergency out of state to make sure that they are tested so that they can re-enter the workforce sooner than if they had to wait to get.
So to confirm, this is not for students.
This would not be for students.
And number two, the idea is that it would augment existing service, outsourced services. Is there training needed? Does this PCR testing device and whoever will be using it need to go through training? Is that part of the cost?
There would be minimal training. It would be less than a half an hour.
Okay.
For skilled healthcare workers. They would be able to pick this up very quickly.
Got it.
The other issue is not only is the equipment itself not available right now, but neither are the test kits. Test kits come in sets of 24, boxes of 24, and they are $41 each test, not $41 each box. So $41.
So $984 a box.
Righto. That is correct.
I got that right.
It's,
I was gonna say.
we hired him for his numbers acumen.
And so, I mean, I would say if the vote was gonna be to put aside money for the 4,500, we wanna probably set a number, let's say, so 500 tests that we have with the Binax, we wanted to sort of shoot for as many boxes as we could get with a goal of, let's say, 240 test kits. I would put another $9,800 aside with this 45.
Yeah, and the challenge is you probably wouldn't want to buy all of those boxes of test kits at the same time because test kits expire as well. So, we might
What's the shelf life on the test kit?
about 6 months. From what we're being told.
You casually mentioned, not casually, but you mentioned in your explanation that other communities use this testing device for the benefit of non-school employees. Is that the intent here?
The school department was willing to work with the municipal side, and so if we had an employee from another department who we thought had been a close contact to someone or somebody who met some of those types of criteria, they would absolutely be looking to assist us in that manner if we couldn't get our employee into a test somewhere else. But the expectation with it, the device would probably be housed at the schools. Or at a school. Yes.
And I presume that's the high school.
I'm not sure, again, I didn't get down on the programmatic level with them as to where they were gonna have it, but Ashland has theirs at the town hall because that's where their coronavirus coordinator is working on it.
I understand. We do have Dr. Kuska on the call. If the superintendent would like to add anything to this request that we haven't already covered, I'd invite you to speak, Dr. Kuska.
Sure, I'd be happy to. Honestly, we're looking for any and all options to try to mitigate and keep the doors open. So this is one possibility, and we also do want to see about whether or not some of our Abbott Binax tests that we already have on hand could be used in another way. The problem we have right now is staffing and being able to use our staff to administer the tests, because people can't enter our building, as Chief Cassidy's just said, if they're symptomatic. So if they're not already in the building, we're not letting them in if they're sick. So we need a format, a location, and staffing in order that if we had 6 staff members, we would still tell them to stay home, but then we would be able to offer test capacity for them. So this is one of many possibilities. We also potentially could use money to purchase seats at, you can purchase a monthly amount of seats so that if you had cases, you could send them off to a particular location and you'd have a standing order basically for seats. So I think it's important if we could set aside some money tonight so that we can explore more than one option, because I do worry that if we can't get the PCR machine, then we might have to do some of these other options. And these tests could be used for students as well, but then we get into a capacity issue. If we're trying to get through using our own staff, we don't have enough access and enough staffing in order to do multiple people at this time. So it's sort of a multi-layered approach, and we're exploring multiple things at the same time because we really need to come up with some solution for the next couple of months until we get particularly the test from DESE. They'll do pool testing for us, and I did do the survey today for that, which is due on January 15th. I sent out the survey. I think we'll be eligible for that, but the pool testing, then we need some way to do PCR testing for all the tests that come back. If a whole batch comes back, then you have to test people individually to find out who the actual positive case was. So there's no easy solution here, and I just think it'd be important if we knew that we had some money set aside at the town so that we could work collectively between the town and schools to support with each other with a plan for this.
Thank you, Doctor. I thought I saw Stacy on the call. Stacy, if there's anything you wanted to add, we'd like to give you the opportunity to do so.
Hi, thank you. Happy New Year, everybody. Great to see you.
Same to you.
Nope, Dr. Kuska and Chief are really the two amongst others who are really in the weeds on this. So I don't have anything further to add.
Okay, great. Thank you, Stacy. Mike, can we talk briefly about the financial side of this decision? The last time we had a look at the CARES Act balance, there was some work still being done. And from a conservative standpoint, the available funds on the town side of that was in the five-figure range, if I recall correctly. We're looking this evening at several requests. Can we achieve what we're looking to do with the available balance?
I believe we can, yes. Well, depending on which option we do. So, if we were to try and put an earmark to guarantee seats at testing site for 3 to 5 months, that could eat up the majority of the municipal funds, very quickly. But if we were putting aside, say, $15,000, which would be for if the testing machine became available and a startup amount of supplies, that would not eat away as much.
And then we're looking at the Board of Health requests, the Council on Aging requests. I guess we need to understand, can we afford this based on what we know to be the available balance of the CARES Act?
Yes, we can.
Okay. All right. So at this point, let's take a vote on the Holliston Public Schools request for the PCR testing machine and supplies, and I think you're going to have to make a recommendation to amend that number from 4,500 to some other number. Do you have that, Travis?
15,000 sounded like the right number to me. That would be based on a number of boxes related to the numbers that Chief put together. And I would just say if the board is comfortable to make the motion so that if the PCR machine, as we're sort of waiting to see if we can attain one, if we find a better option that gets us the same result and access, if the board would be willing to sort of make the motion with enough latitude to allow us to pursue those as well. If you're not comfortable with that, we could certainly take this motion and sort of bring back something as soon as possible on another opportunity.
Yeah, I think the flexibility should be any type of testing machine and related supplies. Beyond that, I think we'd ask them to come back if there wasn't going to be a device involved and so forth. But
Okay.
Broadly speaking, I think that should cover what they're looking for.
Testing program and supplies? A little bit too outside your comfort zone?
Yeah, I think we'd like to probably see a little bit more. Yeah, I mean, if they find something and come back, we'll do it. So, let me revise the motion to suggest a motion to approve PCR. Should we call it PCR testing?
Well, so I think sorry, I mean,
go ahead.
to Travis's
bring
point,
words to this.
I would make the motion, my wording would be that we make a motion to approve $15,000 for COVID testing equipment and supplies for the use of the Holliston Public School System.
I'm willing to second that. The only thing I want to point out, though, is that the school committee has only approved a request for $4,500, so I want to be careful about how we phrase that, just because I don't want to, I want them to have the chance to, if they want to make.
Not more than?
What's that?
A motion that is not more than $15,000?
Correct.
Yeah, I mean, I think, and then if they want to go back and ask for more or amend there, I think that might be reasonable down the road.
All right, so I'll amend the motion to say that we make a motion for not more than $15,000, pending school committee approval, for more than $4,500?
Yeah.
For COVID testing equipment and related supplies.
Stacy, you're on. We have a motion before we get to seconds. Can I have a second?
I'll second it.
Okay, we have a motion, a second. Stacy, would we have reason to believe that the school committee would embrace the larger number? Was there discussion around that?
There was not discussion around that, but at this point, many members of the committee are very anxious, if you will, to get our hands on testing in whichever way we can. So if you want us to re-vote the number, we can do that at our next meeting, but I don't think this would be a problem.
I think it would be a recommendation to square that up to your records, but you'll have our vote this evening to affirm up to 15,000.
Thank you so much. We really appreciate your support.
All those in favor say aye.
Aye.
Aye. That carries. Next one, great much.
Thank you. So the next one, hopefully won't be as multi-layered, but the Board of Health has requested $20,000, and this was voted on by the board at their meeting last Tuesday. And this has two components to it. The first would be contact tracing for November and December. They've already received the bill for November, and it was slightly in excess of $8,000. And knowing that the cases continued to escalate during December, they're estimating that the December contact tracing bill could be close to $10,000. And then they have requested additional clerical hours for the remainder of the fiscal year. So that is their $20,000 ask.
Any questions about Mrs. Sparrow?
It's a kind of a concern slash question, is that if we're paying the contact tracing, which is completely reasonable, and I'm completely in favor of it, I don't have a problem with it, but this is gonna be ongoing. I mean, I guess the question becomes then, you know, with respect to, you know, how much repairs money we have, is, you know, if we're doing $10,000 a month and it's continuing to escalate, you know, are we gonna have enough runway there? I mean, if we hit $12,000 and we do it for 6 months, $72,000, that's a good chunk of change. It's important, it's necessary, but are we thinking about that in our outlook?
So this is their first request to you for contact tracing assistance from the CARES funds. They have used some other funds along the way. They've gotten some earmarked funds through the Mass Boards of Health Association and a couple other funding sources. And those worked very well for some of the early months when we had very few cases. But since we're paying essentially on a per-case base, even the most recent amount that they were told that they would be getting under the new appropriation wouldn't be enough to cover even a month. So I agree, we need a comprehensive strategy because one of the plans was to start incorporating known costs into fiscal year 22 budgets. So the question is going to be, at what point is it no longer CARES, and should we be trying to seek either a reserve fund transfer? But again, reserve fund, as I understand it, is extraordinary and unforeseen. And so is this really unforeseen? Because we've been talking about contact tracing since March. So is it better to use CARES, where specifically it calls out this is an allowable use? And so might we then need to hold off other requests and possibly make those reserve fund requests as opposed to contact tracing? I mean, there's a finite amount of money that we'll have available to us.
So I think we do need to, I'd send back to the Board of Health, like, let's come up with a plan here, because this is not gonna go away, and if this is gonna be an ongoing thing, we need to have an idea of what to do, and loop the Finance Committee in, whatever we have to do to get there, because this is important, and we gotta get it done.
Right. And again, this isn't something that we don't wanna stop doing for financial reasons.
Absolutely. We can't.
This is kind of like when you lose the transmission in the ambulance.
Right.
You need to get it fixed.
Yeah.
So we need to make sure that.
We need a plan. We need
Right.
them to come up with a plan for the next 6 months, so we can get through the next 6 months of this, because
Agreed.
it's foreseeable.
Right.
Good.
That's all I got.
Tina?
The 18,000 for contact tracing, that supports the schools. It's through this contact tracing that the schools are notified and have an ability to respond. Is that fair to say, or are the schools are not doing their own contact?
So there is dual contact tracing, DUAL, contact tracing taking place. If a family member or a student tests positive, they are supposed to notify the school nurse of that student's school, and that school nurse starts doing the contact tracing as it relates to the school. That happens in parallel to getting a call from Salmon DNA to say, were you at CCD, were you at, AAU basketball, were you, playing in the neighborhood? So there are two sets, and they talk back and forth all the time. Our nurse leader and the contract nurse from DNA talk all the time, but I would not characterize the contact tracing that's being done by Salmon DNA that the Board of Health is being invoiced for as they're doing contact tracing for the schools.
Okay.
They're doing their own contact tracing.
So I'm hearing you say this does support the school's efforts.
Support, but it's not exclusive to.
Okay. I'm going to take this opportunity to say if there is an opportunity to have the Salmon DNA nurse provide more information, more support to the schools, I think that would be very valuable. So I don't know if there's an opportunity in this conversation to have that message delivered, but given that the collaboration is important, I think that to have the contact tracing nurse more available to the schools can only be a benefit.
It's my understanding from conversations with the school's nurse leader that she and the contact tracing nurse are talking on a daily basis, multiple times a day. So I don't think that there's a lack of information flow between those two parties.
Okay, that's all. Thank you.
Thanks, Tina. Just a couple of things, Mike. This evening, I'm looking at a total of 3 requests from 3 different boards or committees, that nothing really is discretionary here. After some questions, I'm expecting some approval for these, but I would ask that through Mr. Ahern, we have an update on the financial condition of the CARES Act as it stands after this evening's votes, so that the board has a better idea now as we approach the back end of fiscal year 22 and the remaining time left on the CARES Act, what type of difficult decisions might we be faced with before we need to turn to town resources for some of these solutions. And secondly, I would also agree with Mr. Sparrow, the boards need to have plans for these types of things, and the Board of Health probably owes us a little bit more information on the back end of fiscal year 21's needs. So that would be helpful as well when you give us an update next week for projections, okay? So at this point, I'll entertain a motion to approve the Board of Health request for $20,000 in CARES Act funding to support contact tracing for November and December, as well as additional clerical hours for the remainder of fiscal year 21.
I'll make that motion.
I'll second that.
All those in favor say aye.
Aye.
That carries. Last item, Chief.
Thank you, and the last one comes to us from the Council on Aging, and I did have a copy of their minutes from their meeting, where they voted to make a twofold request. The first was for additional meal program supplies, so these would be containers and utensils and bags, condiments and other things to support their meal program, and this would be through the remainder of the fiscal year. And then secondly, they would like to ask if we could use some CARES funds to offset, and so this would be a journal adjustment, the delivery costs for the meals that they delivered from July through December, which would be the first half of the fiscal year, which this is an exact number.
I'm sorry, so is that fiscal year 21 or?
Fiscal year 21.
So these are expenses that have already been incurred?
Correct, and they would likely come back later on in the spring and ask to cover January through whatever period funds might still be available, but at least at this point, they're hoping that CARES might be able to cover expenses they've already incurred for meals they've already delivered.
Any questions, Seth?
I support this, it's fine, it's just a comment similar to the contract tracing. If meal program delivery is the intention, just making sure that we're putting it into our CARES program, and if we need to make a decision on funding from other sources, we need to keep that in mind. It's probably a comparable amount, 5,100 seems reasonable. Just want to make sure that that's on the radar.
Absolutely.
So that's all I have. Thank you.
Tina?
No questions, just a comment. Accoutrement.
Charcuterie.
Well, I was more thinking the little mayonnaise packets, and but yes,
It's a great program.
I agree with the accoutrement as well.
Amuse bouche.
Those who are doing the minutes are going to, be cussing me out when they listen to the recording of this.
I will entertain a motion to approve the Holliston Council on Aging request for meal program supplies at $3,500 for the remainder of fiscal year 21, as well as reimbursement for the meal program delivery cost of $5,141.74, representing the period of July 1st through December 31st.
So moved.
Second that?
All those in favor say aye.
Aye.
That carries. Mike, before I let you get off on this one, do we have any of these that might touch FEMA? I think the Board of Health, but
Board of Health would be 25% eligible. Meal programs is not, meal delivery is not.
and a PCR.
PCR depends on who it is that's being tested.
That'll come out in your math and your report when we see you next week.
Correct.
Or see
Yes.
the report.
And next slide, Chris, please, and thank you. So just when you thought that you knew what the CARES Act reporting sequence was after the extension, they changed the dates again. We got a reprieve. Instead of having to have our report for expenses of October through December in on January 29th, they've now pushed that off to March 5th. So got a little bit more time to reconcile all of these accounts and journal entries and making sure that we know exactly which bucket of money was being used for which expense. But that just came out from A&F today.
That's great. Those are the kind of changes. Like, went the other way?
Oh, yeah, no, we don't like it when they tell us we want the report now instead of 3 weeks from now.
Any other questions on our Zoom call regarding CARES Act programmatic update questions? So Chief Cassidy. no hands raised, I think you're done for this. Thank you, and also thank you, Paul. We appreciate you joining us this evening.
Excellent.
Thank you very much,
Thank
Chief,
you.
really appreciate it.
We'll now
Sure, I'll be
discuss, warrants. Mr. Sparrow.
My time to shine. All right, so I'm gonna make a motion to approve the warrants, this week in the amount of $1,136,362.40. Of that, $180,239.46 is town payroll.
A motion to approve that.
Second that?
All those in favor say aye.
Aye.
That carries. Public comment. Sparrow.
I have no public comment this evening.
Fine.
I was only gonna say that on Wednesday afternoon, myself and one of the Finance Committee members will be joining a webinar at lunchtime with the Mass Incorporated Polling Group. We'll be hearing data from polling of Massachusetts voters on their priorities to poll, for budget priorities and revenue sources. So, my thinking is not that it will have any relevance particularly to FY '22, but will certainly give some insight as to, again, budget priorities for residents here in Holliston probably, but specifically to the state of Massachusetts. I'm looking forward to that, and I'm happy to be joined by one of the members of the Finance Committee.
Yeah, that's great news. Anything else?
That's it.
Okay. I just have one comment. The town clerk has sent out a notice on January 5th to any and all people that papers will be available for individuals seeking public office effective February 1st, 2021, for the town election that'll be occurring on May 24th, 2021. Personally, I'll be pulling papers, so I'll be joining hopefully a lot of people that are interested in helping us make our town a better place to live. So at this point, we'll ask for any public comments from people assembled on the Zoom call. Hearing none, we will now move on to comments from the town administrator.
Okay, few comments. So I will get into a Q2 update, very briefly. Let me just get into a few things first. The RFQ, for the traffic studies that were approved at town meeting are up. Those are due back by January 24th. A few questions came in and answers were posted. So on the town webpage under town links, procurement, legal notices, we actually have quite a few up there. But the traffic study engineering, RFQ with questions and answers are up. Additionally, the facilities manager has put out the bids for the town hall windows, town hall floors, library facade, library carpet, library interior painting, council on aging carpet, council on aging interior painting. A lot of the business from special town meeting is out there, and we're hoping to get that work done. Additionally, I would just point out, I did send out, after our previous conversation with the stipend committee, they put together a survey that I sent out to the town managers of, I want to say 14 communities at their request. It was well received. The feedback I got from those town administrators was that it was a well-done survey, and they were hoping to get the information back themselves. So hopefully that will help the stipend committee. As far as this group is concerned, I believe that it would be helpful if I got direction from you what date you would be comfortable with the stipend committee now coming back. The original charge was through January 4th. I think we all recognize that they're going to need a little bit more time with this survey. So at the end of January, does that seem like a reasonable date? We can consider January 31st to be the new charge. Just consensus? Okay. I will pass that to them, and hopefully with that information from the survey. Also, I know that they've reached out to the boards and committees in town that do receive stipends for feedback on that as well. But I think the 14 communities that I was able to reach out to on their behalf, that should give them the data I think that sort of was necessary after our last call. I would just also mention separately that the governance committee is meeting tonight, and we should probably consider a time to bring them back as we get into as we approach town meeting in May. But I think we have a little bit of time to do that as now that the warrant will be open through the end of March. But if at any point there's a date requested by the board, just let me know. Otherwise, I'll look for an opening. The Economic Development Fund was approved by the House and Senate and is on the governor's desk for signature. When that comes in, that will be another weapon for the Economic Development Committee and the Select Board and I will bring that forward once it is approved, and we can discuss the rollout of that fund. One other economic development aspect, the LRRP, the Local Rapid Response Planning Program from the state. I do not have an official letter that we've been awarded, although I have received what I would consider to be direction that we will be being awarded that. What the LRRP calls for is essentially putting together a group that includes the town with economic development, with any groups that have economic development in their mission. So the way that I wrote the application would be that myself and a member of the select board would team with the economic development committee. They appointed Matt Coletti as their appointee to that, or liaison to that. The Holliston Together group, which would be John Drohan, and then HCAT, and I did reach out to Bruce Guilfoy from HCAT, and putting that group together. So at this point, Tina Hine would be the liaison to the Economic Development Committee, so I would assume that would be the proper point person, but I would look for any, if that is a misconception, then now would be a good time to point me in that direction.
I mean, I'm happy to have either one of these.
I'll take a motion on that.
What I was going to say is I would think that it would pique their curiosity and their interest.
Usually wait till she leaves the room to make that motion.
No, I'm very happy with it.
No, I think that's fine.
Okay, great. So that's exciting. Again, no actual written approval, but the messaging that I got from them was we're just waiting to get our consultant assigned to us.
How long do we have with this consultant? And
It is a very quick turnaround. So I think
what do you mean by that? How quick?
it sort of looks like it was designed a similar way to the Shared Streets and Spaces initiative. The difference being that it's less of a grant, right? They're not giving us the money and we're engaging. They're providing us with the technical resources if somebody's going to come in, work with the group that we've established that I just described, and give us recommendations on how to sort of help our businesses in the downtown area.
Do you think that a member of the Finance Committee should be on this? And I ask that because, well, number one, they're a valuable voice, and number two, because this is probably going to drive, one can imagine that this is going to drive an article for either May or the fall's town meeting warrant. And so where you're asking for money, they like to be involved, fair enough. Should we get somebody from the Finance Committee in early so they can understand the process?
Sure. I'll be putting that group together to begin with, so I can factor that in. All of the end results would need to be approved through the select board, so it really is just a group of sort of whoever would be interested, and we can make it wider, so I can certainly make sure that, and I believe that it would be Sooner Sessian is the
EDC liaison?
Is the EDC liaison, but I will make sure that I get the liaison from the Finance Committee and loop them in before we get started.
See, that's how it works. Sue's not here. Boom, she's it.
I'll check the liaison list. They did vote their liaisons. I could be wrong on that.
I got it right.
All right, and so I will hop into the Q2 update just briefly, but I'll just point out that next week our budget schedule begins. So I'll be getting some information to you as early as tomorrow on the budgets that we have to discuss at that time. I have them all sort of prepared right now. I'm just making sure that the narratives are all sort of in the easiest form for you all to read. So solid waste, street lighting, celebrations, I just spoke with Steve Bradford on that one for Memorial Day. Rail trail, sealer, liability insurance, sustainability, economic development will be on the 19th. The following week, the select board budget and the water budget with the water rate hearing. So we're going to get going on that soon. So I figured also within my update just a very quick highlight of where we are through our Q2 budget and revenue. If I can certainly take any questions, but I think it would be an appropriate time to do this with next week as we start the budget, really starting to look forward to 22 and me, at least presenting you with some general budget information. So what Chris just put up here is the revenue slide. And again, this is important for S&P to know that on a regular basis, the finance team in the town of Holliston is presenting this information to the select board and the finance committee. They want to know that. They'll ask sort of when this information was presented to the select board and the finance committee. And so here's our Q2 data. I will point out, I think Chris has scrolled down to the point where the bold preliminary at the top of the screen can't be seen, but this is a preliminary Q2 number. So I'm going to point out a few things here. At the very top, the motor vehicle excise at 15.6%, received. The bills are actually due in March, and that's why if you were to factor in an amortization of the collection of that revenue, we are actually in good standing for that budget category. Scrolling down to licenses and permits, again, this is one that is a little bit unexpected at 110% of the assumption being already received. $280,000 of that is building permits, and I think we've discussed this certainly in a number of different contexts. The building department, certainly a surprise to me, has been humming along, and I think, anecdotally what it appears to be is people being home and seeing the home improvements that they'd like to do and taking out the permits to do that. But it has been impressive, the amount of work that they're turning out. And so we're actually seeing that in the revenue number as well. If we scroll down to the state aid section, it looks a little ominous, but at the same point, this is all just scheduled. We get the money from the state when we get it, so that is not a concern for me personally. Lastly, I would just point out on the miscellaneous side, the cannabis revenue that we know is due in February, and on the ones that we're looking at potentially coming in either in FY22 or 23, I will be bringing to you some letters to send out to those individuals so that we can begin to plan that revenue. And what I would like to do, working with Mary Bosquet and Sharon Emmerich, is to begin to create a billing process within Munis to be sending out to those cannabis companies so that we can start to sort of begin to formalize that process. It is a little bit newer on the municipal side of collecting revenue from cannabis companies, so I'd just like to formalize that in town. But that is, once that is factored in here as well, I think our FY21 revenue certainly is in good standing from what I've seen. So I would just go to the budget next, unless there's any questions. I know I'm going a little fast.
I have one question, but go ahead, Tina.
Maybe it's relevant with the budget. I was just gonna talk real quick about the celebrations budget.
Sure.
It's 2,000, it's been 2,000, I think, for the past 2 or 3 years. But it's really 2,000 for FY21, $2,000, that is. So Steve Bradford, who is with the veterans, he sent out a letter to our community, and I read it over this weekend, and in it he talks about how well they've been able to serve the veterans, but how different it has been. And one thing that really struck me in his letter was the thing that he missed and the veterans missed the most was the Memorial Day parade. So my question is this, can we explore expanding that celebrations budget so that if in FY22, which would end up being May of 22, we could perhaps have a bigger celebration for Memorial Day? I was just so struck by his comment that the veterans were really missing the fact that they did not have a Memorial Day parade in 2020.
I think that budget, though, that $2,000 in that budget line is just for the sign, if I remember correctly. I don't think it's much of the organization.
Yeah, and we'll have this one on our meeting next week, so I can bring all that information.
Yeah.
The conversation I had with Steve Bradford today was essentially, it's a $5,000 budget, $2,000 is covered by the town, $3,000 is covered by donations, but we can certainly have that discussion next week when we talk about the budget.
It just struck me that, it's a significant event, and many of us might have just knocked it off as a pandemic consequence. I think it hits the veteran community differently, and I think if there's anything that we can do to support them in a more significant way, at least the first one after, I think that would be meaningful. But just a point of conversation.
Absolutely.
Travis, I had one question. Other financing sources, it's showing $400,000 transfer from stabilization. We still doing that?
Yeah, so essentially, at the July town meeting, $400,000 was used, and at the December town meeting, $400,000 was put back in. But we'll reflect it all here to show the ins and outs. And so, from free cash in that number would be $400,000 going into the stabilization fund, which was approved at December town meeting. But at the transfers from stabilization, $400,000 was used in July. The net result can't be seen here very easily, but in reality nets out to zero.
So we don't see the free cash piece here?
You see the total, which includes some other things, and we can certainly make it clear that what came out of stabilization was put back in.
Put a note in there.
Yes, absolutely.
Fair enough.
All right, and then Chris, if you don't mind, are you all set?
I'm good. I'm fine. Thank you.
If you don't mind just putting this up just very quickly on the budget side, we do appear to be in good shape. We're tracking a few line item issues, but nothing big picture. I would just highlight a few things. The emergency management budget, which is 01291, is 95% expended. That's because of our payment to Blackboard. That's the biggest expense in that budget. For 01162, elections and registration, we see that being mainly expended, but obviously that was due mostly to the presidential election. I want to highlight two things at the bottom here, which would be 01911. The county retirement is showing a balance of $43,524. Previously, what would happen is that we essentially get a small amount back if we prepay at the beginning of the year. And then what we'll generally do is give that to the county retirement system at the end to essentially superfund. What we're going to discuss, and the reason that we're showing it here rather than just doing that, is if one conversation that came up at the prior to the last annual town meeting was whether or not it would be prudent to set up a retirement, a pension stabilization fund, and I think that we will have that conversation again leading in to the May town meeting, and if the select board is in favor of putting that as a warrant article, that we would then use this $43,000 to potentially be seed money for that. And if there is not a desire to do so, then we would always have the option to keep it in Middlesex. So that's why I just wanted to highlight that. That's another conversation to come. And then on the unemployment, it shows that we're very essentially underspent, but as you are all aware, and anybody following along with the CARES Act programmatic updates on a weekly basis, we have strategically kept that to that point so that we're in good position for the second half of the fiscal year by using the CARES Act to offset the I don't want to say exorbitant cost, but very high cost of unemployment in the first half of the fiscal year, and hopefully that's coming down to earth. So that's where we are. Any questions on the expenditures?
No, I fully appreciate the mid-year glance. There's a lot of activity. No, I had no real questions. I looked at this afternoon. It was really on the revenue side, but I think that's it for me. Any questions for the town administrator at this point on public comment? Any individuals on the Zoom call? Hearing none, we will move on. I see Rob Wydeck on the call this evening. How are you, Bob?
Good evening.
We have a couple of items on our agenda, one for the rail trail license and encroachment, and the second for the Mass Trails grant application. You'll be with us for both, is that right?
Oh, yeah, and yeah, both of those. Yep.
All right, why don't we start with the license and encroachment discussion, if you'd like to bring forth that, unless, Travis, did you want Bob to introduce that, or did you want to do that?
I'll go a little overview, but obviously Robert Wydeck has been, sort of involved in all of these conversations, but I'll just sort of go into where we are at the moment on the license conversation. I've added for your packets and the discussion that has happened previously. So essentially there is a list of just under 10 abutters to the trail, I would say, businesses that use property that would be considered the rail trail, which is owned by the town. We do have the ability to set up a system in which those businesses would continue to enjoy use of that property and potentially enter into a license with the town where they would pay for the use of it. They would agree to sort of that use. We would have that agreement, and what Jay Tallerman has drawn up here is a license agreement for us to consider. And Robert can sort of go into why these are in this position, but the background on it also is the calculation that the Rail Trail Group went through with the assessor's office to come up with the value of surplus land is taxed at 11 cents per square foot. About $5,000 per acre is the basis for what this calculation is. And then the list has obviously been generated by their experience dealing with the rail trail. And so the conversation that we would be having if the select board wanted to go ahead with this process is that my office would then engage the businesses on this list to see if they would be interested in essentially entering into a license, which we would then keep up on an annual basis for their use of this space. And at that, I would just say if there's anything I missed in that conversation or that you'd like to add, Robert, that's what they've been presented with this evening.
No, it sounds good. Everything we may want to point out is that we're assessing a flat rate for all types of uses, whether it's a parking area or some other thing. So it's a straight fee that we're using for all of them. So it's pretty easy to manage and easy to manipulate based on how many square foot each entity is using.
Okay, any questions on the license and encroachment discussion?
Well, with respect to the license, I do have questions about the encroachment, but the licenses, I think it's pretty straightforward. I just think, it's just important to make sure, it makes perfect sense. Just thinking about, and this actually gets really slightly to the encroachment questions that I have, which are basically ensuring that any future businesses that are being moved or are certainly made aware of the existence of these kinds of license fees. I just think it's important that we get, as things go forward, the last thing you want to do is find out after the fact that, hey, I want to open a business, and then all of a sudden you're not aware of something like this that's out there, and it just sort of comes up. So just ensuring that we have good communication, and then so that people are aware of it. It seems fine, but it's fairly straightforward. I have no problem with the merits of the license.
Thank you, Ben. Tina?
Yeah, I mean, I think that, I hope that, Robert, that there's broad support from the businesses that would be impacted by this license agreement, that would be approached with this license agreement. I hope there'd be broad support and that they will participate at a high level and embrace it for what it is, which is an opportunity to use land that they don't own. I think we need to acknowledge that the presence of these abutters degrades the quality of the trail. And that, it's an open space. It's meant to be a natural resource for residents of the town and the broader community outside of Holliston. And so, again, I would anticipate, I would expect nothing else other than support by these abutters. And I'm sure we will see that. But I think this is a great idea. I think it creates a very fair situation for all involved. And I think the Trail Committee has demonstrated over and over again their willingness to work with all abutters to resolve issues. And I appreciate the fact that they brought forward this license agreement as one way to resolve the issue of commercial businesses abutting the trail. So thank you for that, Robert.
You're welcome.
I think it's a step in the right direction.
You good?
Yep.
So I just have two questions. The draft we were looking at includes the date of 2020, just as a heads up. I want to edit that. Bob, you mentioned that the fee that is being proposed for the license is flat. Was there any research, comparative analysis, or can you give us any insight as to how you got to the multiplier or the fee structure associated with the agreement?
It was actually in consultation with the assessor's office to determine, what would you call this land? And in a situation where a business has its land that it occupies for its business, this is like excess land, and so the value is based on what would be considered excess land in addition to what is normal, in this case, for a business to operate. Similar to, if you were to have a house and it was a 1 acre lot requirement in zoning, if you had more than 1 acre zoning, that would be like excess land that isn't technically, have a higher value than as it would if it were part of that 1 acre. And so this was considered excess land on establishing that value.
Travis, these licenses are good for 1 year at a time, correct?
Right, that would be the idea.
Each board each year will have a chance to review these items and determine if the value or the agreement is still needed. Is that the idea?
That would be the idea.
Okay, great.
This would be added to your annual license renewals, essentially.
Got it. Okay. Any other questions associated with the license side of this proposal this evening for the rail trail? Go ahead, Tina.
John, I just want to circle back around on the license agreement dating, like when it goes into effect. And so we renew all of our licenses in December. So I guess it was my understanding from the way this is written here that this would be effective as of December 2020, like the alcohol licenses we just renewed a month ago. But the license wouldn't be signed until whenever it gets to the business owner. Am I understanding that wrong, that this license will go into effect at another month in 2021, or it would be December of 2021?
So the licenses are renewed in December by the board, but for January 1 to December 31st.
Okay.
So,
So this would be like a January 1, 2021.
right.
Okay, all right.
And I think, certainly the conversation we could have is, should this be in place after the board supports the licensure and I can get these letters out at the same point? I don't think this is, I think for the most part, these spaces are being used already, so I don't feel uncomfortable saying that it is for this calendar year, even though it's already started, personally.
Has council looked at the license agreement?
This license agreement that you have in front of you came from Jay Talon.
Excellent. You want to vote on this, correct?
That would be great.
All right, I'll entertain a motion to approve the proposed license agreement for the rail trail of Otters.
I'll make that motion.
I'll second it.
All those in favor say aye.
Aye.
Aye. That carries. Encroachment discussion, Bob.
Yes, yeah, this is a sort of a step program where we've previously had issued a letter to all the various abutters that are along the rail corridor. In 2018, we had sent out those letters, and there has been some improvement in some areas. There's been some others areas that have gotten worse, and as new neighbors move into the town, they start new encroachments along the way. So this is like the next round of letters that needs to go out with a little bit more request for a little bit more to have them, remove whatever encroachments they've been doing, and to go forward to try to stop this from occurring.
Any questions, Steph?
Yeah, I got a couple here. So, Robert, this is the communication that was sent out to abutters that have violations, if you will, either it's waste or structures or something like that. Is that accurate? It's not sent to all abutters?
I believe the one in 2018 was sent to specific abutters that had a violation that had or previously occurred adjacent to or into the rail trail.
Robert, I got one.
Uh-oh.
Uh-oh.
Oh, and then it must have been a general letter, because you're not encroaching. I have to.
Well, right. And I brought that up because I remember reaching out to you and saying, "Hey, we got this letter. What's our issue?" And it was a general letter sent to all abutters.
Oh, okay.
Okay,
Perfect.
that's my point. Is I want to make sure that there's I think we should be communicating annually, perhaps, with all abutters. Hey, these are the rules, so that way people, as they go forward. And then certainly we can have some, escalated language for certain people, but I think it's important that everybody knows, hey, this is what our expectations are. Not that we don't want to slap people on the wrist for breaking the rules, but I want to make sure everybody understands what they are.
So isn't that number 5 in the letter, specifically as to your property? So would that be removed except for those with known issues? So it would be, you start the letter here, our request is fourfold.
Yep.
And then there's a 5th item specifically as to your property. So I would think that would be the one added into those with known issues.
Just to be clear, this letter was drafted again by Jay Tallerman, and the 5th is what I asked Robert to provide to me, which would be the specific property and the issue that has been identified and previously stated. And so I would fill this in, and I would get this out to each of them, or Robert and I could sort of determine that. But essentially, this is, as Robert indicated, an escalation of a previous correspondence that has been sent to these properties to say that it is still happening, and what we're looking for to happen within a certain period of time.
But we would send to all abutters the first 4, and then the people who have violations, the number 5 would be included. Is that correct?
I had looked at it that way, but I'm sorry. Go ahead, Travis.
No, my focus has been on making sure that we're following up with the people who've received that they need to be changing behavior.
Okay.
And so that's my focus, but at the same point, I think we can certainly take whatever we're comfortable with.
Yeah, absolutely. I mean, I think it would be important to make sure that all abutters had some language sent to them to make sure they understood it. And then also, if they're not in violation, indicate you are not in violation, some kind of thing that say, hey, this is just telling you what the rules are so you're aware of it. You haven't done anything, but, just so that way as they're moving forward and thinking about adding something or throwing something out, that they're not using the rail trail to do so. So if we need to make some adjustments to the language, getting rid of number 5 and maybe adding a line that says something to that effect, I think that's something we should be doing as well.
Well, I think you can achieve what Ben is seeking to do with this letter and just add something in there that said,
Yeah, just a line at the beginning.
if your property has been identified as in violation of any of these measures, please refer to number 5, and then you'll have those letters would be targeted to the individuals that Bob has identified. Then you're getting both of the messages out at the same time. Can't believe you got a letter. God.
Well, can I just add one comment here? Twice it's referred to contacting the trail committee. If it's possible to provide an email address, I think that might be helpful. I know this is a draft form. I'm sure it was coming. I just didn't see it there.
Yep, that would be fine.
The only question I have is, with regard to encroachment enforcement, does the town have adequate bylaw protection to take steps to deal with any abutters that are ignoring our rules, or do we need to consider a bylaw for enforcement action on the rail trail?
And Travis, I don't know if you have anything particular in that. There's nothing in our bylaw specifically related to either the rail trail or parkland for that matter. There is a state law, which I have to call up what it is.
There's also in there, while you're looking that up, some language in the sort of when we came to take possession of the rail trail. It's for residences specifically. There's pretty blunt language about not allowing residences to sort of encroach on the space for reasons that have to do with the original purpose of the rail.
Is that the covenant with the rail trail company? I mean, the rail company?
Yes, that's what I'm referring to. But I think, Robert, you were looking at a state statute as well?
Yeah, there's a state law that it's Mass General Law, Chapter 270, Section 16, that revolves around dumping on either town land and or town rights of way. And so I always chuckle on that one because that makes me think of Alice's Restaurant, if you know the tune. That's basically where the law comes from for that dumping. But there's, like I said, there's nothing on the town level specifically in terms of fines, but this one does establish fines and punishment and that sort of thing for people who dump on town property.
Is the mention of that particular general law and section and associated fines, does that have a place in this letter, in your opinion? As an enforceable action to sort of fortify what we're trying to get done?
We can certainly put that in.
I would turn to the town council on that one.
I'll have Jay see if he feels it's appropriate to add that.
I think our board has had their chance to questions. Any questions from those assembled on a Zoom call for Mr. Wideneck regarding the encroachment issue on the rail trail? Hearing none. Bob, I don't think, do we need to take a vote on this at this point, or do you want to further discuss edits on this, Travis? What's your preference?
So if you'd like to see a review, if you'd like to review any changes, if we're going to add anything to it, otherwise, I think just general support for another round of follow-up.
All right,
so it's really up to you
let me
if you'd
put
like
together
to see it again.
Yeah, let us give you a vote of consensus here. I'll make a motion to approve the encroachment letter to include both the annualized effect of notifying all abutters, as well as using sections of the letters for those abutters that are known to be in violation of Mass General Law, Chapter 270, Section 16, with some consideration of listing that general law, associated fines in the letter pursuant to general counsel feedback. Excellent. Do I have a second on that?
I'll second.
All those in favor? You good?
Yes.
Okay. All those in favor say aye.
Aye.
So you have the approval for the encroachment letter. Some edits have to be made to get the idea of where we're trying to direct this. And next, Bob, Mass Trails grant application.
Okay, this is a request that we had made last year as a result of sort of a maintenance consideration, but this was a grant application through Mass Trails. It's basically administered by the DCR, and most of the funding that we got for the construction of the trail itself came through this program, the Mass Trails program. And so what we've requested last year, and this is basically a repeat of that same request since we weren't granted that funding, was that it would be to install a drainage pipe on the section running from the tunnel towards Little Folk Farm on one side of the trail. And this has become a real maintenance headache. We attempted this year, and it took 5 people 3 different times to try to get the leaves out of those ditches, because once they get wet, they get heavy, they get sediment on top of it. You just can't remove them easily. So what we're hoping to do is to install a drainage pipe, cap it over, and would actually give a benefit of making the trail wider through that section, which is fairly narrow. Make the trail wider, and then we can leaf blow all the leaves off the one side and then remove them at our leisurely pace when they stay dry. So it's, like I say, this is a request that we'd made last year. We weren't awarded it. We were encouraged to apply again because there is so much competition for funding for trails. So this request is basically a repeat of that same request from last year. And in support of that, we need a documentation from the landowner. And in this case, the town is the landowner. And so I would be looking for a letter from the select board saying that you grant the Trails Committee the right to request this funding on this land that we own. And then also as part of that letter would be a letter of support. So you had done this similarly last year. And so I gave you a copy of the letter from last year that you could simply update, and I'll include that as an attachment to the document, the grant request that I send in.
Any questions on that, Pat?
The only question I have is, so the budget worksheet, is this the same worksheet from last year then, or does it need to be updated?
No, I think the prices are pretty close to what it was last year. So I didn't update the pricing at all. And as part of this, it's a match. And in the past, we've always been able to do the match using volunteer help. And so in this case, the match is, I think it's around $10,000 and change. And so for the $30,000 application, we have a match of $10,000, and we'll do that with volunteer. And we could count volunteer time towards that match. And like I say, we've been successful in doing that in the past.
And my other question is $30,000 for the project? I mean, obviously there's some in-kind proposed matching here. Is that going to be enough? Is there a little bit of flexibility here if there are any issues?
You can't go back to the DCR and ask for more funds in this case. So I think if there is any flexibility, if there is a requirement that we need more money, we would, seek alternative methods. We would come back to the town to go to town meeting, say, to request it. We would seek alternatives such as Lions and/or Friends of, or other sources. So I'm pretty confident that we can do it within this.
Okay. That's it.
All right, Tina.
Does it improve the drainage under the 5th tunnel at all? There's occasionally flooding under there. Does this address that? I'm thinking of some of the first night walks that feel like we've had somewhere that's quite muddy in that area. Does this help with this?
We actually improved that, and it hasn't been a problem since. We actually put in a perforated drain through the tunnel, and so that has relieved it quite a bit. We do still get a bit of water, and I think it's groundwater rising up on what would be the northwest quadrant of the tunnel that comes across, but it hasn't iced up like that. The first night, was very bad because we were at 2 to 3 inches of ice there. And I spent a lot of time the first night, New Year's Eve, chunking away the ice to open it up. But we've basically resolved that by putting in a perforated drain.
I thought it was maybe the dry weather. So, okay, I have no other questions.
All right, we'll make a motion on this, Mr. Sparrow.
I will make a motion to approve let's see, we would want to have a letter from the select board to the rail trail committee that would first of all support and also grant them the ability to put in this grant because we are the owners of the land. So there would be 2 letters that we would approve it.
So the motion is to authorize the town administrator to draft a letter in support of the Mass Trails grant application to, is it DCR?
DCR, yes.
DCR?
Yep.
I have the motion. Do I have a second?
Second.
All those in favor say aye.
Aye.
Aye, that carries. Anything else for us this evening, Bob, regarding the rail trail?
No, I just want to thank Travis for his work in getting the Generosio parcel closed by the end of the year. So we are part owner in that piece of land, and we'll work next year to try to get the other owner to donate the land there. But thank Travis for coordinating all that.
Thank you. Excellent. Thanks again, Bob, for all your continued great work on the rail trail.
Thank you.
We'll move on to our agenda to an update on the Stantec studies from the DPW liaison, Ben Sparrow.
Sure. So this past week, Sean Reese, the DPW director, Travis and I had a call with Bill and Erica from Stantec to just sort of outline what our needs and requests are for the studies that were approved at town meeting in December. So, there were some talks of the details. Basically, looking at to try to update inventory with respect to things like the sidewalks and the water mains, and also developing a strategy for replacement, both financial and in terms of need, based on condition and opportunities for improvements to the systems, both the sidewalks and the water. A few things that came out of it. First of all, we want to make sure that the output, particularly with respect to the inventory, would be electronic. So we'd be able to use that data to input into our GIS system. So that way it's just not going to sit in a binder on the shelf. It's going to give us, fresh, good data that's current, and that way as we make improvements and adjustments and add things, we can update the electronic system. That was one of the pieces. The second thing that we discussed was timing, when we want to make sure that we have output. I did inquire if it would be possible, particularly on the sidewalk side, if we could have some kind of output before the warrant closes in March. It might be overly ambitious, but it would really depend on the weather. So, if we're, it's very hard to see the condition of a sidewalk when it's covered in snow. So, I'd like to have something to be able to put in front of town meeting, because I want it to be part of it should be part of the budgeting process. And, if we lose out because it was, we wouldn't be looking at including it in the budget process until next year, and we wanted to try to get involved this year, if at all possible.
That's great.
So with water, it might take a little bit longer, but that's a little bit of a different kind of a process because the projects tend to be larger, so they often can, and it requires a little bit more information. So we might not be able to get that before town meeting in May, but we would absolutely 100% have deliverables for October. So we would be looking at hopefully a summer product that we can discuss, so we can start working on including it and figuring out what our next steps would be for the October town meeting. So that was one of the main things that I asked was what was the timing of what we're going to see, and then the second thing I wanted to really emphasize was making sure that whatever they provided to us was something that was certainly can have some engineering specifications, but I wanted to make sure that it would be able to be understood by a dummy like me. So that way I could look at it and be able to see, okay, this is what it is, this is what we're going to do, these are the action items that we have, and then we can take it and run with it. So that way we're not trying to spend, an undue amount of time trying to interpret engineering documents. We could actually be taking this and we could really be working with it to execute on the next steps. So I thought that was very important, and they heard me on those things. And then what we came away with is, they're working on, they're going to have the contract, I think, this week, so that we can sign them and really start getting into the nitty-gritty and the details. And we would be, Sean and I and Travis, depending on his availability, would be meeting with Bill and Erica on a monthly basis until we have deliverables. So that way, if we have questions for them or some comments that we needed to address, or if they had, vice versa, they had some questions for us where they said, hey, what about this? Or if they're running into any obstacles or challenges that they needed the town to act on, they'd be able to. So I just kind of wanted to give you an idea, sort of a high, 50,000-foot look on what's going on, and see if you had any questions or suggestions. The only other thing I want to add to this before you do is it is my intention to work on the DPW facility article for May. So that is on my radar. I just sent an email out to James to talk to him about putting together, basically thinking about, what would a maintenance plan look like for the existing facilities, and then comparing that, using Dude Solutions, we'd be able to do something like that, put out an output of like what we'd have to do for replacements and things like that based on existing conditions and such, and seeing what that would cost, and then could juxtapose it with potential new facility and using that as part of that process. So we've just gotten started on that piece. We're in the preliminary stages, so that's going to be something we'll have more details as we get closer to warrant time later in this process. So do either of you have any questions or comments or anything about the studies? And
Tina first.
Sure.
So I think it's great, Ben. I think you're doing a great job with this. The comment that you had to make about a deliverable for town meeting, so before the warrant closes, really stuck out to me.
I'm hopeful.
Yeah,
I'm not going to guarantee anything. I asked, but we'll hopefully have something. But if we get a couple blizzards and we don't, the snow's covered, it's going to be hard to look at what the sidewalk.
Don't worry. I tend to forget these kinds of statements. I'm sure I won't remember that. But what I specifically wanted to say is, we had the forum with the Lowland Industrial Park of Otters. There were quite a few, I mentioned this to Travis, there were quite a few comments that came out of there with ideas, specific, really basic, simple things, right? Like the crosswalk there, Lowland Street across Woodland to the sidewalk. There were some very specific suggestions that residents brought forward. There are a few other places that one could go, and I didn't know if in your monthly meetings with the Stantec folks, if you're looking for something, I understand that it's still a question mark, but if you were looking for something to go into the warrant before it closes the end of March, if you could present some of those ideas to see if they've already explored them. Because it may just be a point where you could say, this is something we really want to focus on. You're already looking at it. We know we have resident comments. We know this is something that would really be meaningful to the community. Can we look at this? I could share those with you or through Travis, but I think that we have some examples of the residents of the community giving us quite significant feedback as to where they're looking for rather small changes. So that's one.
Okay.
When you talked about something that was in layman's terms, and that you're not reading engineering plans, I 100% agree with you. I'm looking for it right now in my email. I cannot find it, but Soul Systems did a great job. I think it was through Beth Greenblatt. A couple months ago, she gave the one-page overview of the benefits of the project.
Yep.
Remember that? It was like bullet point. It was.
Yeah.
I printed it out. I have it saved on my desk because I found it just something that's very clear. It's the whole project in a nutshell, one page, a couple bullet points.
Absolutely.
So that may be something to share as an example if you're looking for a layman's terms presentation or product that we can all use.
Okay. No, absolutely.
To understand the scope of the study.
Okay.
That may be an example. Those are my two comments. I think you're doing a great job. I love the idea of the monthly meetings.
Yeah.
I think that's great to stay on top of this and present back to this board. I really appreciate that.
Sure. Absolutely.
Thank you, Tina. Just a couple things, Ben. These studies that you're referring to trace back to the special town meeting articles 8, 9, and 10. At the time, I believe we were informing the town that each article would take between 3 and 6 or 6 and 9 months. Can you tell us when the clock starts on those time estimates?
It'll be when we sign the it should be in the next, I'd say the next week or two, next couple of weeks when we sign the contracts. They're drafting the language now, and we'll be signing those contracts.
Yeah, I've not received a contract yet.
So it should be it would be very soon, so I would say the clock should be starting, at the latest, just to be conservative, I would say by February 1st.
Okay.
I think that'd be conservative, but.
So going back to your hope of having something available, by the time the warrant closes, I think the only realistic one we could probably expect to see is on the water supply side. The sidewalk and the water main, those are gonna take 6 to 9 months, in term. And if the clock hasn't started yet, I'm not sure we'll have a lot to report.
Well, I mean, I think, you know, I think.
From an expectation standpoint.
Yeah, I mean, no, I understand, and I think, I mean, I'm just referring to, you know, the conversations we had with the Stantec folks, is that they basically, you know, it depends on a lot of things, like, you know, we have existing data, how good is it, how accurate is it, how fresh is it, you know, I think there's a lot of pieces that we're, you know, they're collecting the information, but they kind of don't know that they don't know what we have yet, because we haven't shared it with them. So we're, you know, that's still kind of a work in progress, so, you know, I'm hopeful, you know, I might be ambitious, but I did make that request to see if we could have something, for March, by the end of March.
Understood. Regarding the DPW study, that would be great, Ben. That's, as you know, this board's been dealing with these 4 articles for a while. Mr. Keys did perform an analysis of both facilities. Do you have a copy of that?
I do not, but I'm working with Mr. Keys, so we have a meeting on next Wednesday, I believe, just before the inauguration, so we'll be able to watch that. And to discuss next steps and looking at what to do, you know, do pollution reporting and those reports, and thinking about things like, you know, what is the impact on having vehicles parked outside and things like that, maintenance and those kinds of things. So we'll discuss that presentation that he made at that time and see if there's any updates he wants to make.
Great. My recollection was that the determination was that both facilities are well beyond useful life. And I'm on the record as saying I won't support any dollars of maintenance going into either facility.
I totally agree with you, but I also need to make the case I want to make the case that, you know, here's to everybody that, hey, this is the reality that we're facing. If this is the road we're going to go down, we don't have the resources to do it. We need to go another route.
Any questions on the Stantec studies or public works? Yeah, go ahead,
I had one part to the conversation, and I don't know the answer to this question, so I'm just sort of entering it into the discussion of, you know, we're going to be getting back quite a bit of information from engineers, and we don't have a town engineer specifically to be doing this. So if at some point we get information, you know, we'll be using everything we have at our sort of at our fingertips here. But at the same point, you know, we're relying on these engineers that we've acquired. So I think one of the conversations that we've had long term is whether or not we need some engineering services in house and how that might look. It's just something that I would enter into the conversation, looking ahead to FY22 and beyond, quite frankly, not necessarily in FY22.
Sure.
But there's a lot of different ways that can look. I think, you know, it's come up quite a bit as I've looked at, you know, we had a number of studies looking for engineering services at our December town meeting. We have a group like TAC that in another community that would rely on a town engineer or engineering services in-house. And so as we look at these, obviously, we're going to be getting a deliverable, but us as the select board, as a town administrator,
how are we going to maintain this?
Right. I mean, we're going to be using this information, but we really do need them to present it to us in the technical format, but also a sort of readable format.
Yes.
And I think, you know, we'll have to sort of gauge what we can do with that information.
Fantastic point. You and I have had some conversations about this over the last week. One of the things that struck me following this past fall's walkthrough with MassDOT was the town's overall sense that, you know, from a state roadway perception, we're not in the game. We don't really have a consolidated state roadway strategy. We've given MassDOT a letter of priorities, what we know, but from an engineering perspective, here we are looking at our infrastructure for water main replacement, sidewalks, and so forth. I think it's something we need to have a closer look at to find out how can we take these studies and integrate them into the state road infrastructure improvements that we know are so desperately needed, because they define our major thoroughfare, and with all of the issues you just brought up, looming for the town of Holliston from a traffic perspective, it's critical we look at that. So let's try to bring that into a future agenda so that we can discuss the possibility of state highway review and possible funding for strategic planning for those as well. Good.
Do these services exist as consulting services? Is it possible the town trials through a consulting contract prior to a hire? Is that a one path?
So we do contract our engineering services in a number of regards, whether it's the planning department, the DPW.
But that's generally through like an RFQ, through a project, through a specific study.
Yeah.
Okay.
Yeah, I mean, the thing that comes to mind most readily to me is, right, the town engineer of Danvers retired, and now he'll contract out his services to Danvers, but also to other communities that he had come across, and he had worked with the regional water system up there, so he does work for them. And under state guidelines, right, retirees are an option to sort of engage to up to a certain number of hours. There's those sort of opportunities. There's a number of things that I think we can look at to sort of, if we're not prepared to pursue a town engineer position within FY22, there are other things that we can do to make sure that we have access to that type of knowledge.
Yeah, I mean, I don't know how I feel about it, except not all engineers are the same, of course. And, do you lose something if you generalize by having one engineer do a whole bunch of different projects that actually have different levels of technical skill and detail, or is there such an option where you have a stable, so to speak, of engineers with all manner of different types of experiences and technical abilities who you can pull on based on the need? I'm thinking of something like our town council, where you have different attorneys who provide different types of advice to the community. That's what I'm thinking of. I might be making that up in my mind, but when we talk about these different types of projects, we were talking about specific and different types of engineering challenges, and so that's my one comment. It's not really relevant to what we first started talking about, but I wanted to share that.
To piggyback on that, I think it's important to remember a couple things, and that first of all, we spend a lot of money on engineering services.
Right.
You look at stormwater, we spent $93,000 in December. To do the Winter Street, just the water, just to be able to figure out all where the water mains go and where we're putting everything, that was $78,000. Okay. We're doing a lot of engineering, and I'm not saying that a town engineer could offset all of those costs, but there's certainly probably elements of that could be offset. Yeah. And there's probably, I would say, ample opportunity. But I think the larger point is that we're doing these kinds of studies, and one of the challenges with the last study is it kind of sat on a shelf and didn't do anything. And we need to be able to drive this to be something that's actionable and it's living information, so that as we make changes, we're updating, or as laws change, we're updating to be able to understand that, hey, this pipe is antiquated, we need to replace it because now suddenly, there's a new drive by DEP to make different changes. So I think it's important to remember that, this is a step in a process and not an end to it. And I think we have to make sure that we're doing that. And personally, I think, I've had conversations with Travis and others about town engineering. I think that might be the route. I don't know enough about that sort of thing, but I think we need to make sure that whatever we do with this information, we take it for years to come, and it becomes part of a living breathing part of our infrastructure, and that we can take action based on it effectively. I think that's very important that we do that.
I think we can bring it in as a future agenda item, Travis, something else set for us. We'll kick that around some more. I think the pros and cons, especially with regard to what our surrounding communities use for their kind of planning, would be helpful. Because it's clear to me Holliston's way behind the 8 ball here. We've got to do more to strategically plan for these kind of infrastructure improvements, because the outcomes or the measurable action items that Ben's talking about, they're measured in years, in some cases decades. So, all right, any other questions on that? Let us move on to the next item. Just as a note, we had an item on our agenda to discuss the Marshall Street Solar Project. We're postponing that, as I think we elected to do last week, until January 21st. It'll be a Thursday evening discussion. We encourage folks that are watching us this evening to tune in. It'll be a very interesting discussion on a major project that's slated for Marshall Street. It's a project that's been going on for about 3+ years at this point, and we're reaching some critical moments, exciting moments in the plan that I think citizens will be delighted to hear about. So that'll be January 21st, a week from Thursday, I believe. This Thursday. So we'll be moving on from that. The next item is the Metrowest Regional Solar and Clean Heat Challenge Program. I'll start with you, Travis. I do see Rich is on our call tonight. Is Matt on the call? But maybe
He's not. I shot him a message, and I'm realizing that we had talked about putting it on, but I'm not sure I had made sure that he was aware of it.
We have data in our packet, but if you want to bring
Sure.
everyone up to speed on what this is, and good evening, Rich. We'll bring you into the conversation in just a second, unless in the event you want to contribute to the idea, okay?
So the municipal partnership agreement is sort of what's been here. As you'll note, the document was dated in December 2020. Matt Zedek had been sort of in communication with these other towns, the town of Ashland, Natick, and Framingham, and let them know that as he needed me to make sure I was getting this in front of you, that early December was a very busy time with our special town meeting. And that I would get it as soon as I could in front of you. And that is how it comes to you on January 11th, 2021. So I'll just read very quickly the statement of purpose, and then a couple items, and then we can discuss. So the purpose, the purpose of this document, as you see it, and you have 3 within your packet, but one would be to establish shared expectations and mutual accountability for an effective municipal partnership to jointly manage the Metrowest 2021 Regional Solar and Clean Heat Challenge. We would partner the town of Holliston, Natick, Ashland, and Framingham, and develop a clear understanding of the mutual partnership obligations. We'll promote effective and collaborative deliveries of services to benefit residents of each community. One thing that I wanted to point out, and I'm not finding the exact language I was looking for here, so just give me 1 second, is the most important aspect from my perspective, just sitting here, although the benefits Matt Zedek could probably point to much better, would be that there is zero cost to the town, including is the sort of language within this that codifies that there is zero financial impact to the town. And I don't know why I'm not finding that specific language. What we would be doing is appointing a point person. Are you seeing what I'm looking for?
Page 2, 3, section 2 of 3, section 5.
Yeah, this is a non-binding partnership agreement between the partner municipalities, and the undersigned agree to simply partake. We would be providing Matt Zedek, the sustainability coordinator, as our point person, and that is really our commitment at this point. The RFP that would go out for all 4 has been attached as well, as is a checklist of sort of everything involved in it. So if Matt is not with us, looks like Rich may be available to speak. Do we want to?
Sure. Do you have anything to contribute, Rich, to this program?
Hi, Rich Rosenberry, 66 Jarbrook Road. This program sounds good, you know, both solar panels and the different forms of heat, both air and ground. And to be able to find a qualified vendor to provide these services to people in town there's 2 things, both, you know, be able to negotiate a better price than individuals would because of the large contract. And also the vendors would be, you know, qualified. We work through a bunch of vendors and find the most qualified.
And I'd like to add that Joan Levinson, 66 Jarbrook, Holliston, that when we're looking at a vendor, we're really looking at one that can offer many options to each customer, whether they want to rent it or whether they want to buy it outright. And some of these solar companies are just offering one of those two options. So we're really looking to give the people of Holliston the most choices.
Thank you, John. Thank you, Rich. Any questions, Mr. Sparrow?
Yeah, I have one. Have the other towns approved and signed on to this?
Yes, they're waiting on us.
Okay,
Again, that was more, we were, busy at the time.
absolutely. Okay, that's my question.
Tina?
I'm just looking at the other members here, Framingham, Natick, and Ashland. If I'm correct, all three of those sustainability coordinators are hired at least part-time, if not full-time, by the town, whereas Matt may be the only one of the four who is contracted for services for the town of Holliston. So I'm just wondering about how many hours. It doesn't sound like a heavy lift at all. That would be my one concern, is that, Ashland looks like they're taking the lead in terms of running the program. So I'm sure that puts a far less burden on Matt in terms of time. But again, I just point out the difference that he's contracted. The other three are, I think that they're all full-time sustainability coordinators, and I'm, again, wondering how many hours this will be, and looking for confirmation that this is not an enormous amount of time committed to this program.
Yes. Oh, I'm sorry.
Go ahead, John. Go ahead, John.
Tina, there's Rich and I and Utah that are committed to helping him out with this project. We've, been on it from the ground, and I've been on a meeting with the Ashland sustainability coordinator, with the other towns also. So he's going to be getting some support from us on moving forward with this.
Is that through 350.org, or is there not, or are you just as individuals or the residents of the town stepping up?
As individuals.
As individuals, yeah.
Okay, all right. Okay, well, thank you for that.
You're welcome.
I would say, just to your point, we have had some questions about, some of the ag rate things, that people calling and sort of looking for information, and we do use Matt, so that's, a lot of those are private questions from residents, right, that the town is not really getting involved in necessarily swaying people one way or another. But when people call for information, we put them in contact with Matt through email. So there's certainly a risk that, this may take up some of his time that could go elsewhere, but I don't see it, I don't see it pulling him away from anything else that we're asking him to do.
Okay, all right, that's fair, thank you.
All right, I don't have any questions. I think it makes perfect sense to engage in these kinds of bundled mass purchasing power agreements. So I'll entertain a motion to approve the town's entry into the Metrowest Regional Solar and Clean Heat Challenge Program.
So moved.
I'll second that.
All those in favor say aye.
Aye.
That carries. Thank you, Rich. Thank you, John. Good to see you both.
Thank you.
Thank you.
Appreciate your help.
Thank you
on that.
very much for that. Really appreciate it.
The next item on our agenda, why don't we just call this the fire department gift portion of our agenda?
There's a grant in there.
We will ask the clerk to read yet again a gift to the fire department.
Fire department is very popular.
Isn't it?
Seems like every week is their birthday. So I make a motion to accept a gift to the fire department gift account from the Carl Road residents. It is an unrestricted gift in the amount of $500.
I'll entertain a motion to accept that gift.
I made that motion.
Sorry, I'm delayed there. I second that.
Yeah, okay. All those in favor say aye.
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 Thank you. Keep going, Ben.
All right, and then we have a grant to emergency management. So I will make a motion to accept a grant in the amount of $2,500 to the Emergency Management Department from the Massachusetts Emergency Management Agency, MEMA. The purpose of this gift is it's a DHS FEMA State Homeland Security grant.
Is there any match associated with that? No? Okay, great, thank you. I have a motion to accept that grant. Do you have a second?
I will second that.
All those in favor say aye.
Aye.
Aye. That carries. Thank you, Ben. Other business this evening. Mr. Sparrow, anything?
I have no other business.
Ms. High.
I have two things, and they're both for Travis. Next month, confirming next Tuesday is the Front Street Forum, the Shared Streets and Spaces grant.
It is Tuesday, you're correct, yeah.
Okay.
Tuesday didn't sound right, but yes, it's the day after
Monday,
MLK Day, so
Right.
yes, Tuesday.
And then in terms of prep for that, will we be getting suggestions or ideas or thoughts or comments, anything from the DPW that this board will be getting ahead of time? Or will they be present at the forum to share their thoughts and ideas at that time? They obviously had a huge role in installing much of the changes, and it's also their backyard. They operate just around the corner from where these changes are in place, and any permanent changes that might come are probably going to land potentially on their lap. So I feel like that's a very valuable voice to have in the forum next week. So either ahead of time or at the time, that would be useful. And
Excellent. And if I could just take that opportunity to mention the fact that I did reach out to the state on the Shared Streets Spaces Initiative, and got a grant extension on the remaining balance of the $12,000 that we had received. So that will be able to factor into the conversation we have next week, depending on what direction the board would like to go.
probably always better to show up to a forum with money to spend than not.
Yes.
I think that is good news. The last thing I was gonna ask is, can we, at some point in the near future, if it's ready, an update on the Complete Streets, progress to date? I know they had that wiki map out for residents to use. I think most of those types of surveys get hit hard initially and then sort of fade away, so I'm just wondering if Sean's prepared to give an update. If not, that's fine, but,
In the context of the Front Street or?
sorry, Complete Streets, the Complete Streets
But
Tier 2.
not in the context of Front Street, you're saying
Correct,
you want to?
separate.
Okay.
Thank you, that's all I had.
You good? Okay. I have, two items. The first item, I just want to circle back to where we started. I felt compelled when we were speaking to the chief to make an appeal to Holliston residents to, listen to these community coronavirus updates and make, the most difficult choices, to hopefully, keep themselves, their neighbors, and their friends safe. It's on our minds every week. It's not just on our minds at the beginning of the agenda, so please listen to the advice, adhere to the advice, and be safe. The second item for my colleagues, I'd like to entertain, a motion to direct the town administrator to, produce a draft letter to our congresswoman, asking for, federal relief, in the form of what we'll call CARES Act Phase 2. As many people know, the stimulus bill that was passed by the president or signed by the president in late December did not include relief for, states/locals. There is some hope and promise that that will occur under the new administration. But I think when we last, made our appeal for CARES, this board did endorse a letter to our congressional delegation. So I think we should do the same again. We've talked about it before. Sure. And so,
I'll make that motion.
we'll have a motion to,
I'll second it, but I just want to make a comment.
please, we have a second at this point. Go ahead.
Just to make sure that, we get the schools and the finance committee, because I'd like to see everybody signed on to it,
Absolutely.
especially the schools.
You good on that, Travis? Sure. Okay. Well, all those in favor say aye on the letter, congressional letter for supporting CARES Act.
Aye.
Phase 2. That carries. Thank you. Any other business from anybody on our Zoom call this evening? Hearing none, I will entertain a motion to adjourn.
So moved.
Do I have a second?
Second.
All those in favor say aye.
Aye.
That carries. Good evening, Holliston. It is now 8:35. We hope you have a pleasant evening. Good night.